welcome to drop your questions in the chat. In the meantime, we will see them coming in, or you can just wait for the end. If you've got any specific questions, then we will tackle them. Right, there we go, Margot.
Thanks, Francois, and evening, everybody. Good to see you all. I recognize quite a few people, which is awesome. So let's jump in, and some of the topics for tonight are just really focusing on things that come up when we're talking about our clients, and I think it's well worth spending the time. So we'll just talk about some things we need to consider in our different clients, some of the things that worry us when our clients are not responding in the way that we expect, looking at how do we dose in practice, and a little bit of the theory, and then we'll look at always that question of contraindications. Can I use this? Can I use that? So just to start off, sorry, I jumped the gun there. Just to start off, just remembering that photobiomodulation and the red and infrared light is what we call non-ionizing form of light. So it's not damaging like UV. It's not UV at all. And the other thing that's quite important is that most of the conditions or medications where they say they are photosensitive, it mostly pertains to ultraviolet, and which would be, again, considered a wavelength of light that can cause more damage to the skin, etc. So we're not working in that wavelength at all. Remember, it's a non-thermal process, but we're going to really unpack this because our clients do say that they feel comfortably warm. And so these issues we need to just almost streamline and get back to a way of thinking about it in the context of each individual client. So the thing to consider with your clients or your patients is that we might have a standard dose, we might have a particular protocol, but you also have a dose that's good for your client. And the things that commonly come up in practice is the clients complain or comment about getting very hot. For some clients, they will talk about having had fatigue, maybe a day after the session, maybe 2 days after the session, maybe the same day after the session. We have some clients talking about having a detox reaction. What would that be about? And then we have some clients who don't respond the way that we expect them to. And that's something that also we get a lot of questions around. So when we look at our clients, I'd like you to think of your clients as they're flowers. Some of your clients are orchids. So they're very beautiful, very sensitive. You know, you go to Woolies or one of the nurseries, you buy this fantastic orchid that looks so beautiful, you pay a lot of money for it, and it dies after 3 days because it's high maintenance in some way. Whereas on the opposite side, there are dandelions. Those are what we call weeds. They're growing on the street, through concrete, and nothing seems to faze them, and every other flower in between. And I'm just borrowing this concept from Adele Diamond, who's a neuropsychologist, because she talks about this in the context of people's psychological responses. But it kind of serves us to remember that our clients are all quite different. And what makes them different is their nuclear genetics, just the genes that they've been dealt, how resilient they are, how strong they are, but also their mitochondrial genetics or mitochondrial genomics. How, in a sense, robust are their mitochondria at the level of their individual capacity? And that will play a role. So not everybody's going to respond in the same way. And when you look at a client who has a certain reaction, really good to say, you know, is this person just more sensitive? Do they require more time, more care, maybe slower treatment? Is there something special about them? So very important to just think about your clients from that perspective. And there's a number of things that we do want to bring into consideration. And probably the most important one is something called our clients' redox capacity, but also their age. Are there any other pre-existing health concerns? are they stacking other modalities on top of the photobiomodulation? And then there's the issue of stress, whether it's mental and emotional stress, whether it's stress that's coming from other influences, like the huge array of what we call non-native or non-natural electromagnetic fields that are out there. And that includes the wrong kind of lighting. And then are they on medications that are possibly mitochondrial or even stresses or even toxins? So I'd like to go through all of these just to help you. And I think something important for you to do is just run through your mind some of the clients and the particular situations that you might find yourself in with clients who are not just following the normal trajectory that you're expecting. So let's talk about redox. And redox is the balance between the kind of exhaust fumes and the waste products of metabolism and the mitochondria's capacity to mop up those waste products of metabolism. And we really call these waste products from a redox perspective reactive oxygen species. Now, if you remember what is happening in a mitochondria, and we know mitochondria are targets for photobiomodulation, your mitochondria are using about 90% of the oxygen that you're breathing in. So oxygen is a key player, and that's why we say reactive oxygen species. So as oxygen is making its way along the electron transport chain, it can start to get it up to nonsense. It can start making mischief because it can inadvertently translate into oxygen compounds that are maybe missing 1 or 2 electrons. So they're quite different in their charge and in the way that they interact with tissues. And in a healthy mitochondria, we want to get the oxygen across those complexes of the electron transport chain with the minimum amount of exhaust fumes. And that would be perfect, but that's not always the case. So the body has got a system where it reduces these highly charged reactive oxygen species, and that's where we talk about redox. So if we have these reactive oxygen species and they're not being mopped up and they're not being balanced by antioxidant capacity, then we start to get into trouble. And this ROS, or reactive oxygen species, it's an important signal when it's at the right level and the right intensity. But when the mitochondria get overwhelmed or are producing too much reactive oxygen species, it causes damage. So these reactive oxygen species can bump into the membranes in the mitochondria and actually burn in and oxidize the fats in the membranes. They can damage the little enzyme called cytochrome C, which is part of your cytochrome C oxidase. And what happens when that little enzyme is damaged, it feeds back to the mitochondria to say, hey, the cell is getting damaged. We need to kill it off. We need to cause what we call apoptosis, cell death. And also, these reactive oxygen species can open pores in the mitochondrial membrane as well, and things leak out of the mitochondria, and that's a danger signal. And essentially, those cells start to firstly get damaged. We would call this inflammation in a sense, but what would happen is that we either get disease or aging because our mitochondria are not doing what they should be doing, and they're literally aging in front of us because of all of the signaling that's going in the wrong direction. And the reactive oxygen species causing mitochondrial dysfunction or cell death, but also what they do is those reactive oxygen species can signal to the nucleus of the cell and trigger the transcription or the encoding of certain proteins that might be unhelpful, and where we have anti-inflammatory and pro-inflammatory balance that can go out of balance, and that further enhances a whole inflammatory cascade. So when we look at people's, shall we say, levels of oxidative stress, and we see all the things that are going on, damage to the fats and proteins in the mitochondria, inflammation, damage to the DNA, disruption of the signaling in the cell, we know that this oxidative stress can be the foundation for cardiovascular disease, diabetes, neurodegeneration, and even cancer. So one thing to bear in mind is when we have a client who's already got an existing condition, we know that their redox is not 100% because they already have oxidative stress, unless their system is being very, very well managed. So because we know that our clients have all got very different mitochondrial capacity and also genetically might be quite different, what we can really understand is although we've got a host of antioxidant enzymes in our mitochondria to mop up those free radicals, genetically, we might have a few of these very important antioxidants that aren't as active as one would hope, that maybe have been deleted through genetic mutation. And so our antioxidant capacity might be somewhat hampered. And a diagram that you've seen before is where a mitochondria that's healthy is making a lot of very good, important cellular energy, ATP, and just a little bit of exhaust fumes in the state of what we call oxidative stress. And where redox is not working, there's a lot of exhaust fumes, not as much energy for the cell to do what it needs to do. So when we're looking at a client who's having a challenge with getting very hot under the photobiomodulation panel, 3 minutes in, they say they got very hot, they're sweating, and you're thinking, wow, this didn't happen with my other clients. Often the mitochondria, because they cannot manage the little reactive oxygen species motivation that the photobiomodulation is giving, which is an important signal to do important things in the cells, they go into a full-blown oxidative stress picture. So people's redox capacity, often we need to build it up very slowly with maybe a shorter session, the panel higher, and listen to what they say about their experiences. People can tough it through, so they don't tell you that they've been getting really, really hot or they're having some kind of reactions or intense fatigue after a session. And you'll probably find that over time, they actually find that these what we would call negative symptoms go away. But it's really important for us to know so that we can maybe turn down the dosing a little bit, and then also encourage them to do things that will benefit their redox capacity, which we'll talk about some other things that also key into this. So someone's redox capacity is probably the most important thing that we want to take into account. And someone who already has an existing illness or struggling with intense fatigue probably has somewhat hampered redox. So we sometimes have to treat them a little bit more like an orchid than a dandelion. So that's something that we can think of. The age of a client can be quite important as well, because our older clients might need a gentler starting dose because their mitochondria have potentially over the years mutated, and we call this mitochondrial heteroplasmy. So what that is our mitochondria mutate, and we have more mitochondria that are functioning somewhat poorly versus ones that are functioning healthily, and that ties into the mitochondrial theory of aging. Also, our older clients might have poor redox, and they also have less intracellular water. And so the hydration, the benefit of hydration in the tissues is not as high as one would find in a younger person. And that begs the question, what about children? So we often get the question, is it okay to use the photobiomodulation on young children? And the answer is a resounding yes. And I'll share with you some research that was done using your visible red light wavelengths in the neonatal ICU to try and reduce something called the retinopathy of prematurity. So premature children often have, premature babies have got a risk of blindness because their retina is a little bit, it's not up to speed because these children are born prematurely. And so they looked, would red light benefit this? Because there's lots of mitochondria in the retina. Could this help? And interestingly, it didn't help at all from a research perspective because you couldn't get the children to actually, get the light in their retina. It was difficult. They would turn away from the light, etc., etc. But what was really interesting is that all the children, all the little neonates who got the red light in the treatment group survived, and they were severely premature. So they were less than 30 weeks old, and they were all less than 1.1 kilograms. So that is a tiny little babies. So all of them who got the red light survived, and as opposed to 89% who survived in the untreated group. So can you treat babies and children, etc.? Yes, but you would want to just, again, be very careful, low dosing. But there's always a question: can we use red light for children? Absolutely. Here they used it for children who weren't even 0 days old, in a sense. They were like minus weeks old because they came so prematurely. Again, it would be a very specific group of people or group of clients, moms with little ones. But there certainly is no danger if we give it some thought and we follow some of the advice from the literature that's there. So just a thought on that for us to keep in mind. When we look at pre-existing health concerns, again, anyone who has inflammation has got oxidative stress. So we might need to coax them in the right direction and check that they're not adding fuel to the inflammatory fire. So what is their diet like? Are they drinking enough water? What sort of other exposures do they have? And two things that really stand out in terms of mitochondria being able to respond the way that they need to is an individual's vitamin D status and their iron status. Vitamin D, because it's such an important signaling hormone, and someone who has a vitamin D deficiency is not going to be able to respond in the way that we expect because there's a signaling pathway that's missing or has been hampered. And in the mitochondria, iron is a critical component of many steps in the electron transport chain. So someone who's anemic, things are going to be slow for them. The other thing is that we're using red light and infrared light, but there are a lot of other wavelengths of light that come with full spectrum sunlight that complement the red light therapy. So someone who lives in a cave, in their room, in front of a computer screen, might not have the same response to photobiomodulation because they're missing some of those other very important wavelengths of light. Hormonal imbalances might add insult to injury, particularly if those hormones are, again, involved in inflammatory signaling. Circadian mismatch is a huge issue for many individuals. And when someone is sleep deprived or out of sync with the natural timing that comes with the light and dark cycles, they are in an inflammatory state. So individuals who are working shifts, individuals who are what we call night owls, that can have an impact on so many aspects of physiology. But bottom line, it sets up inflammatory stress in multiple organ systems. And then, of course, the diet. If the person is living on ultra-processed foods, that is not helpful for any aspect of mitochondrial function. And just a point here with pre-existing health conditions, we would be very careful with sessions using photobiomodulation if that person has got active systemic infection, particularly a high fever, or any kind of infection that's not currently being treated. So our red and infrared would definitely complement proper treatment. You don't want to put yourself at risk by missing the opportunity to encourage someone to get proper treatment for a condition that you maybe are noticing. So the other considerations, and it's one of the reasons why we have a conversation with our clients around the other things that they might be doing, stacking treatments like using methylene blue, ozone therapy, hyperbaric oxygen therapy. All of those are already demanding more activity and adaptation from the mitochondria. So we might need to space things out. Remember, we have something called those reactive oxygen species that are involved in they are produced as you're trying to get oxygen across that electron transport chain. And if you're forcing oxygen in through hyperbaric oxygen or forms of oxygen with ozone therapy, you might be creating more reactive oxygen species that the mitochondria are working hard to adapt to and to mop up. You don't want to hit the person with photobiomodulation on top of that. What the general consideration is that if someone wants to do something like hyperbaric oxygen or ozone therapy, that a course of photobiomodulation would be a very good way to prime them for much better outcome if they were going to be using ozone or hyperbaric oxygen, but not at the same time. And then something that's really quite interesting and just a thought is curcumin is something that potentiates the red light wavelengths in terms of photobiomodulation. So it's been used in what we call phototherapy, where it's actually activated by the red light. So I don't know whether there are any curcumin-based skin products that someone might put on their skin, but if there ever was, it's going to potentiate the action of the photobiomodulation. You never know what gets put into cosmetics nowadays. So some thoughts on that, and then this concept of stress. So we know that stress is a systemic experience. It's not just in someone's head. It's a physiological experience. And for the mitochondria, what we know is that when we are in a stressed state, our mitochondria actually make more free radicals. A stressed state, mentally and emotionally, psychologically, is an inflammatory state. The brain becomes inflamed as a result of the signaling of the stress hormones and how they interact. So we want to encourage our clients to manage that. One of the major stresses that we're seeing nowadays is that people are being exposed to a lot of Wi-Fi and dirty electricity. They're sleeping with their routers next to their beds. They're sleeping with their cell phone next to their ears, and they're on screens all the time without dealing with that blue light that's coming from the screen. So all of this can actually be stressing out the mitochondria. And it would be a very interesting thing for you to look at just what are the habits of your clients, and look at the ones who are maybe getting out in the sunshine, getting their feet on the ground, interacting with nature, versus the outcomes in clients who are indoors all the time in front of screens and then on their cell phones all night and in front of TVs and living under artificial lights and never getting out into the sunlight. So something that we also just bear in mind, and if we want to work holistically with our clients, it's something that we want to talk about with them. And then the third aspect on this slide is just that there can be mitochondrial stress because of medications, exposure to pesticides, additives in food, artificial sweeteners, and with the tendency in South Africa to have the sugar tax, many soft drink manufacturers have just loaded products with artificial sweeteners. And the outcome of that is that people are getting much more of a load, thinking that they're okay because the soft drink has got less sugar in. But many of these artificial sweeteners are actually mitochondrial toxins. And then glyphosate, Roundup. So that is a herbicide, a weed killer, the things that people spray in their driveways, that hammers our mitochondria as well. For those of you who are more medically inclined, here are all the medications that can have an impact on mitochondrial function. So remember, your client who's on a list of medications, their mitochondria will be really having the benefit of your photobiomodulation, but you might have to go slower because the mitochondria have had a lot of stress because of medications that that person might have been on for an extended period of time. So just some thoughts about why it's important to have conversations with our clients, but also to take into account that everybody is quite different, starting with their genetics, their mitochondria, and all those other things that influence those systems. So I'll take a deep breath, and you can take a deep breath just to kind of let that sink in. And then we're going to touch on a short discussion around dosing.
Is there any questions so far on the presentation? While Margaret takes a break, we'll take any questions right now. Otherwise, we can wait until the end.
So there was a comment on the chat. Therefore, also safe to use on pregnant women, and absolutely safe to use on pregnant women. But the recommendation is just because not everybody is as comfortable as they could be about that, put a little towel over the tummy. But mom can still benefit systemically, and that whole environment that the baby is in will benefit as well. But we don't want to scare obstetricians and put questions in people's minds. So put a little white towel over the pregnant tummy. Mom-to-be can lie on her side. She can lie on her back. She doesn't want to lie on her tummy. That's not necessary. Put a little towel over there and you're fine.
Another question here is, will it benefit someone who has PCOS?
So there has been some research on that, and because of the inflammatory aspect, the hormonal aspect, and the insulin resistance that often comes with the PCOS, the results are looking very promising. So it certainly is worth working on that. I think it's early days. There's not a ton of research, but the research so far is looking very promising.
Okay. And then any impact on breastfeeding moms?
Only positive impact, in the sense that it actually helps the nipples respond and heal. Because many women who breastfeed, it's often not that they're not producing milk, it's that they have sore nipples. And so it actually helps the nipples to heal from that new stress of the baby breastfeeding. I know there have been questions about women who now want to stop breastfeeding, and if they're having photobiomodulation, is it going to stimulate breast milk? And it doesn't seem to be the case. But if a breastfeeding mom wants to have photobiomodulation, no problem. If someone doesn't want to breastfeed and they're like, I think this red light might stimulate my breast milk, put a white towel over there, and we're all good. But it's really great for the nipples to heal, and especially if the mom is having trouble with sore nipples. It's great for that. Good. So let's talk a little bit about dosing, and this is probably the hardest part of the presentation because they've got to play with these numbers. But in photobiomodulation, there's two numbers that we like to talk about. One is something called irradiance. That's involved with the power of the dose, and that's milliwatts per centimeter squared. And then another concept called fluence, which is around the energy, and that's to do with time. It has a time component. So those are two numbers that we talk about. And let me illustrate this by saying that if we had a device that is having an irradiance of about 100 milliwatts per centimeter squared, or 0.1 watt per centimeter squared, and we put the person under that power for 10 minutes, so that would be 600 seconds, we would say that our dose is 60 joules per centimeter squared. And currently, when you read literature, they often quote things in fluence, joules per centimeter squared. But remember, joules per centimeter squared has got to do with the irradiance, and it's got to do with the time. And many of us say, well, you know, you could increase the time and decrease the irradiance, or you could decrease the irradiance and increase the time. So the fluence doesn't really tell us much. So it's quite important for you to know, I've got a device. This is its irradiance at the distance that I have this device, and I'm going to start on the recommended dose, and if my patient gets too hot, I can lift the device, or I can shorten the time. But we'll talk about that, because sometimes what you want to do is rather lift the device and keep the time so that there's exposure than shorten the time, and then there's not enough exposure for the system to adapt. So we're balancing things. So my general advice is, when you're using a particular protocol and you want to decrease the actual dose, by lifting your panel higher, you decrease this. Keep the time at 10 minutes or whatever you've been using for your session, mainly because your mitochondria need the time to respond. And this is more in the context of using an LED panel than it is with a handheld laser. So everything that I'm talking about is much more in the context of the devices, the MedWave devices that we're using. And photobiomodulation and dosing it's got two faces. It's kind of like a coin with two sides, or it's got two faces. And lower dosing increases ATP production, nitric oxide signaling. You get more oxygen because of vasodilatation. It starts to turn the overall signaling in the tissue to a more anti-inflammatory tone. You get better immunity and less cells being damaged or destroyed. At a higher dosing, you get things called heat shock proteins and signaling molecules that are involved in managing and protecting the system in the face of heat. You get a decrease in ATP, interestingly. And that might be useful, because in the process of these things coming into play and ion channels opening, you get less pain signaling. So we know that often we see in a lower dosing, lots of energy production by the mitochondria. Higher dosing, we see other kinds of adaptation that can be very, very useful. So just a general consensus, and again, we're talking more in the sense of panels, is you get enhanced healing with a lower dose, As you go with a slightly higher dose, you might get sort of superficial anti-inflammatory, nice little sort of soothing response. You can get deeper structures, healing. When you get to the higher dosing, you start to get analgesia. So there's different things happening at different doses. My advice is not to get too caught up in it, except to say that you'll find that, again, there's a heating and a warming benefit that does some interesting adaptation, but there's also the benefit of the low dose. So dosing is by no means a done deal. There's still lots of discussions around that. Our kind of first principle thinking reminds us that photobiomodulation is targeting a system that needs to respond and adapt, and it's responding in the session and it's responding between sessions. So you need a rest day in general, unless you're treating someone very specifically and you've now decided this is the strategy we're going to take. But in general, a rest day for adaptation. Do you want to use high power for a very short period of time? You might overheat the person, and there's not enough time for appropriate stimulus. So winning time is not always a good idea. And what about lower power for longer? Not so much heating. You are allowing adequate time for adaptation. And it's been very clearly shown in the research that the mitochondria like to have time to adapt even in the treatment session. So 10 to 20 minutes is a great general time. So I think most of us are kind of working in that framework. And just a reminder that when we heat up our bodies, slightly small increase in temperature, a lot of enzyme functions are actually promoted. So mild local heat actually assists our cell division, circulation, wound healing, even bone regeneration. So, you know, a couple of degrees temperature going up, no problem. When we heat up a bit more, we trigger what we call heat stress proteins. And those heat stress proteins and also the activating transcription proteins, they protect the body against the heat damage. They protect the work that they're busy doing. They protect proteins that they've just made, that they're still busy forming. They help the cell kind of not damage anything that it's been busy with. And actually it strengthens and builds resilience in the cells. But when we start to overheat, what's very important, and this is considered to be when the temperature starts to go above 42 degrees. So that would be like a fever. That results in inactivation of enzymes, and particularly two of our antioxidant enzymes. So now we will start to go into oxidative stress, and our redox will fall apart. So a small amount of heating is not a problem. The person saying, I felt comfortably warm. The person going like, wow, I felt like I was getting a sunburn, or they're sweating. That's too much. Then we're possibly even going past the benefit of the heat shock protein activation, and now we're kind of causing damage. So watch for that thermal effect. And the more an individual has trouble with redox, and the less antioxidant capacity they have, to a large degree, the faster they will heat up and be uncomfortable as a result of that. So I don't want to kind of bore you with this heat story, but when we start to go too hot, we actually coagulate some of our enzymes and proteins denature, so that's not a good idea. Kind of a general hyperthermia or milder increase in temperature is fine, and the cells can take it for the kind of time frames that we're using in photobiomodulation, but don't overheat. very, very important. So a couple of other considerations for our clients is that we use the eye protection because of the brightness of the device, not because the device is going to damage eyes. Remember, dark underwear absorbs more heat, so cover the area with a white towel. Otherwise, people overheat if they keep their underwear on or they have some very dark clothing. Women actually might require shorter sessions because they've got thinner skin and they're more thermally sensitive. So that's something just to bear in mind. And then individuals with a darker skin tone, they reflect more light. And so they might need a longer session, but they get hotter because their skin is darker. So you might have to lift the panel slightly and increase the session. And I'll show you just a slide that reminds us that when we do shine light on the skin, a bunch of it reflects off, a bunch of it reflects all over the show. It's bouncing around like crazy. And here's a picture in a dark skin and in a light skin. And what we see is that in the dark skin, there's a huge amount of reflection, and the melanin, the pigment in the surface of that person's skin, absorbs all the light. And so much less light goes down into the deeper tissues. And that's why you need a slightly higher panel, but longer time, because you need time for it to get through that highly pigmented layer. So just something to think about on that side. And then another important consideration, and people are often talking about that, we've mentioned pregnancy. In cancer, what we say is if there's an area where someone might say, well, I've had cancer here, or I have cancer here, and they've consented and the oncologist is happy, just cover it with a towel. That's it. There are no direct contraindications in the literature to photobiomodulation in either of those conditions, but emotionally, people can get very tied up about, is this okay, isn't it? Let's just not do direct treatment of the fetus in a pregnant woman or directly over an apparent tumor mass, unless the specialist has said, okay, go ahead. And then thyroid is also a question that comes up. And there was a lot of deliberation about it, but new evidence is coming out that photobiomodulation can actually enhance and support thyroid function. So what we say is that someone should be monitored of sessions. So just bearing in mind that if someone is on thyroid treatment, their thyroid might actually recover. And so after they've done this, maybe they've done 10 sessions or 20 sessions for something else, but they are on thyroid medication, they should have their thyroid checked, just because we have seen thyroid functions balanced out. So let's take a couple more questions. Yep. On the dosing, on the client and dosing side.
Right, you're welcome to drop it in the chat again if you don't want to ask it. But yeah, any questions, please shoot them.
And you can even just put your mic on and ask the question. So just while we're waiting, so that's the reason why you would have an intake form, why you would ask your clients questions about what medications they're on, just so that you know a little bit more about them, so you can kind of make the assessment. You know, is my client an orchid? Are they a dandelion? What is it telling me about their mitochondrial resilience? What does their history tell me about their genetics? The more questions we ask, the more effective we can be in meeting people's needs. The red and the infrared wavelengths are phenomenally safe, and photobiomodulation is incredibly forgiving. And I think everybody knows that shall we say, the dosing is still very much up in the air. So very few people say this will be the dose for that in every person, because every person is different. So follow the lead of the client, and bring your curiosity and your brain along for the ride.
Right. There's a couple of questions here that we can answer. One is there an information sheet or consent form that we can send to the overseeing doctors? I know we've got one for our patients, but we don't really have one we send to the doctors, right?
So based on what you would be doing in your particular setting, you can put together something that reflects the service that you offer, and encourages the doctor to send you patients who you feel that you would be able to assist. So I think that very much depends, and depends on how you as a practitioner want to roll with that. How do you use photobiomodulation in dentistry? So dentistry, mostly because you're working as a dentist on small little places in the mouth, often it's more handheld photobiomodulation devices that are used to get into those nooks and crannies. But that being said, if you are working with maybe pain, whether you're working with post-surgical pain, you could be using a panel just as effectively hands-free for your patients for wound healing. Any progress in getting this ICD-10 coded? So Jessica, there are some wound sisters who are getting the photobiomodulation with a MedWave through on ICD-10 codes. So I think I would suggest reach out to Davide. He's got the latest update on that. So this is quite new. So they found some coding. So if you are someone who has got a clinical practice and you're registered with the with the Board of Healthcare Funders, so you've got a practice number, there are some codes that things are going through on, which is really great. And then question on, will it benefit people with fibromyalgia? So there's been some encouraging work with panels, LED panels and fibromyalgia. So Marlene, if you want to kind of reach out to us, I can send you a paper on that. But with fibromyalgia, again, you have individuals whose mitochondria are very decompensated. So you often have to start really slowly. And so it's a longer term process because their mitochondria can't be whipped into shape. Ilse, how well does the light penetrate while the client has some clothes on? I would say the infrared is pretty good at getting through clothes. The red, to some degree. Ideally, we want as much skin exposed. That's the bottom line. A little bit of underwear is not a problem. Post-op patients for wound healing, very basic protocol, 10 minutes with a panel at about 10 to 15 centimeters, depending on heat tolerance. Compressed nerve problems for the pain, but you have to deal with the source of that condition that needs to be managed. If there's some kind of bone and nerve impingement problems. How does this tie in with vibration? I need a bit more information on that, Michelle. And then what is an acceptable height to position the panel from the body during treatment in normal instances? So generally, it's going to be somewhere between 10 and 30 centimeters. And that's going to depend on just your client's feedback. I often start at a high maybe at about 20 centimeters. I work down, I see how that patient goes in their 10-minute session, whether they get too hot, whether they feel fine. When I first started working with the device, I started with the panel up at about 40 centimeters and I worked my way down. So what you don't want to do is take it less than 10 centimeters, because that starts to become an overdose and you're going to get into too much heating. Yeah, I'm not too sure what Michelle wants me to say in terms of tying in with the vibration. What I might be able to say is that with the vibration plate, there are many more contraindications, because one has to be careful, and also one has to be very good at making sure that the person is using the right posture. So Graves' disease, if that Graves' disease is already managed and being treated appropriately, it's an inflammatory condition in terms of the thyroid. We would say that in that instance, it's more for the systemic benefits. I wouldn't say, well, we're treating that disease. It's a very, very specific disease in the context of the whole body. There would be no contraindication. With the dystonias, also no contraindication, but we couldn't say that we actually are treating that. We would be looking at benefiting general well-being. That's really is the way to go.
Well, we've got such a great mix of people here, from neurologists to nurses to GPs to chiropractors to beauty therapists. It's incredible to see. And I think many of you guys will use this for body contouring and combining, the vibration plate with the red light. So I just got a question for Margot. As let's say a non-medical provider, if someone comes in for body contouring, what are some key elements that they should tell the client to maybe change or tweak in their lifestyle to help get them, good results, or help elevate the results?
Yeah. So this might sound weird, but if I had to say, the most important thing for a patient, if they want to get the best out of their photobiomodulation, is to get a tan and get into the sun. So that is because we're going to get proper vitamin D that is being produced the way nature intended it. You're going to be having melanin, which is one of your key antioxidants. You're going to sort out your melatonin. You're going to sort out your circadian. You're going to have less inflammation. Then diet might come next, but certainly I just want to point out there, I'm going to lose battery power in a moment, and I'm not sure why. I think we've been unplugged. So again, going back to just the basic principles of our mitochondria and as a human being, back to basics. Get out into the sun, get sleep, get the appropriate light, get the appropriate dark. So circadian overrides quite a lot of things, in my opinion.
Right.
Cool.
Thanks, Dr. Margot. That's, again, so much value in a very short time. So I hope you guys, can take something from this. We'll have this session recorded as well. If you want the presentation, we will send it off to you. We don't hold on to these things. If you need any other support, please reach out. And if there's anyone on this call that would like to get started with MedWave, you can just reach out to any of our team members, and we can jump on a call and start a conversation and see if this is a good fit for your business and for your practice. So if there's no more questions, then we are going to log off, and we're going to see you for another session probably next month. Cool, guys. Have a good evening.
Thanks very much. Go well. Cheers.
Thanks, everyone. Lovely seeing you.